Should I get like an Oscar for this one? Now, when it comes to veins, okay, I always go where the blood flow begins and then ends. So with veins, we're going from distal to proximal to the heart. Okay?
Is that a rib pointer?
Yeah, I got the rib. That's right. You remember his AP1. I love it. Okay, now let's start with the head first. A lot of the veins, when we're talking about deep veins, have the same name as the arteries. Okay, but this is an exception. Okay. We know that this artery here is the common carotid that turns into the external and internal carotid. The veins, however, are a different name. The big one here, which is basically draining the majority of blood from the brain. See how it's like it goes up, and yeah, you have some that are coming out here, but this one's coming up and it kind of disappears because it's going inside the cranium. Therefore, we call this the internal jugular vein, specifically the left internal jugular. It's very large because it's taking a tremendous amount of blood from the brain. Okay, so this is where you'd have that superior sagittal sinus that connects to the straight sinus, that turns into the transverse sinus to the sigmoid sinus, and then it's continuous as the internal jugular. We don't see the sinuses here because the head is intact, okay? So we could go over that with another thing. Now, the other thing is that we have to understand is that the internal jugular is a completely different vessel than the external jugular, which is here. Remember, a lot of people say, well, I think the two come together just like the carotids. No. The carotid, yes, there's a common carotid that becomes external and internal, but the external and internal jugular are completely separate all the way. And if, again, we follow this, look where it's going. Outside, right? Here, here, here. It goes outside the face, therefore this is now external jugular. Okay? So, the external jugular vein and the internal jugular vein will enter into this vessel right here, which is underneath this bone. Subclavian, very good. The other vessel that it will accept, and you can see it more so on, actually you can't really see it on this one. But there is the vertebral vein as well, but we can't really see it here. All right, so we're just going to skip that. But let's start now with the arms, okay? We have two arches, two venous arches in the hand, okay? These are the deep palmar venous arch and the superficial palmar venous arch. Superficial is closer to the knuckles, while the deep is closer to the wrist, to the carpals. Okay? Now, when we're doing the deep, if we follow it up, they become the deep veins. Okay? Which again are the same name as the arteries. But when we do the superficials, those become superficial veins. And there's the two superficial veins that you need to know. If we follow this one, and again, sometimes you have to use your imagination a little bit because it disappears and then it resurfaces. But it would basically come around here, okay, and it goes this way, and then it comes up here, and then it goes up here, and 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 it goes all the way up to here, very close to the head. All right? So the radial side, the superficial vein on the radial side, that is continuous with the superficial palmar venous arch, is the cephalic vein. Here's the cephalic vein. Again, cephalic because it means head, because it gets really close to where the head is. Okay? The other one, if we follow it this way, kind of disappears but comes back. If we follow it up, it's on the ulnar side or the medial side of the forearm, and it continues, and then it basically will form into this, it will fuse into this vein here. So this one on the inside is called the basilic vein, the basilic vein. So basilic means base, cephalic means head. So basilic is lower than the cephalic. Okay? Now, let's again go back to now the deep palmar venous arch here. And if we follow it up, okay, let's go on the ulnar side, we follow it up, here it is, it's going up, and it kind of disappears, and then it resurfaces here, and then it goes all the way, it's deep, remember, so it's kind of hard to see. It goes underneath things, and then it resurfaces, but then it stops here and it merges with this vessel here. So this one on the outside, or I should say on the inside, okay, where the ulnar side, is the ulnar vein. See how it's continuous with the deep palmar venous arch. Okay? If we follow on the radial side, it goes up here, okay, goes in, kind of disappears, goes underneath again. So it resurfaces probably around here. So it goes, it's underneath these, it resurfaces right around here, and then it goes up, and then it comes here. That's the radial vein. So the ulnar vein and the radial vein fuse and form this single vein here, which is called the brachial vein. Okay? Now the other superficial vein that you need to know connects the cephalic vein and the basilic vein. It's here. And that's the median cubital vein. That's where your venipuncture usually takes place. That's where you're getting injected, or you get the needle, the IV or whatever. Okay, so it's right there. All right, so you know that that's superficial because it connects one superficial vein with another superficial vein. Okay.
Why does it connect there?
Why is it? Just as an anastomosis. So blood, if for some reason there's a problem here, it could still get back to the heart. There's a lot of these. You know, this is just one single one, but there's a lot of different connections. All right? All right, so anyway, let's get back to the brachial. Here's the brachial, and then we said this was cephalic, and the brachial and the cephalic together form now the axillary, right? And actually, I'm trying to see here. Okay, yeah. So this is a little, again, this is still in the brachial region, but this is still axial, goes over here. Okay, this is definitely axial here, all right, in the armpit region. And the axillary, okay, I'm sorry, not axial, axillary goes all the way up, and then the cephalic vein will merge with the axillary, and these two form the subclavian. The subclavian, okay, subclavian accepts now the external jugular, but when it accepts the internal jugular, it forms another vein, specifically the brachiocephalic vein, okay, on the right side. You okay? You hurting? Okay. So everything that just happened here happens here. Now here, what are the, if I was to ask you, name this vein right here, what would you say?
Cephalic?
Cephalic vein. Cephalic vein right here. Okay? Does you see it? Now the reason why, now you know it's superficial because it's where in comparison to the muscle?
On top of the muscle.
On top of it. Okay, if it's underneath the muscle, then it's deep. This is on top, so you know it's the superficial. All right? So this is, so again, everything that just I went over here, same thing here. So the two brachiocephalic veins come together and form the superior vena cava. Okay? When we go to the leg, to the lower leg, all right? Let's see here.
I can't get the leg.
Oh, not that much higher.
You want me to get down? You need me to get down?
No, I'll just go like between you. Here, watch. I'll stick my hand through here.
No, this is what I'll
We're
do.
good.
You guys are okay. Okay? We start here. Again, we're going to look for different arches in the feet. Here's one on the dorsal side. And then there's one deep underneath, which we can't really see. But here's the dorsal one, which again is just called the dorsal dorsal venous arch. That's it.
But we gotta say superficial or deep, right?
You don't have to for this one. For
Okay.
the dorsal venous arch, because it's on the dorsum of the foot, it's understood it's superficial.
Okay.
The plantar venous arch, which is the deep plantar venous, is deep, but we can't see it on this one. So if we follow medially, here's the dorsal venous arch here. If we follow it medially, it comes and becomes this very large vessel that kind of is cut. So if we look on this side here, here's again that dorsal venous arch here. We follow it medially. it becomes this very large vein on the outside of the muscle, which we call the great saphenous vein.
Was that where they pull for coronary?
That's right, exactly. They'll take the great saphenous or the small saphenous. The small saphenous is on the outside here, but that's not on your list. You don't need to know it, okay? But when we go up, we could see that the great saphenous will enter into, this hole here, this is a hole that in the muscle, so you can actually see the deep vessels. If you see an artery, it's deep, okay? So this is the femoral artery, this is the femoral vein. The great saphenous and the femoral vein together will enter into the abdominal cavity and form the external iliac vein. Okay? But before we get to that, we can see now some deep ones. We know these are deep. Why?
Inside the muscle.
The muscle's cut. Number two, it's alongside the artery. So what artery is this?
Should be the posterior.
Posterior
Tibial.
tibial. So that vein is the
Posterior tibial vein.
posterior tibial vein. Yeah. And there would be an anterior tibial vein, but it's not on here. Okay? Posterior tibial vein will become the popliteal vein, which again is behind the knee, you can't see it. And then that will continue up as the femoral vein. Now this is the
artery.
femoral. How do you know this is femoral?
Because that's through the artery.
The femoral artery is right there, and the muscle's cut. See? It's all cut out. So they're peeled it up so you can see inside. So here's the femoral vein. This is where the great saphenous vein would be. That's cut because, all right. So the great saphenous and the femoral forms, okay, when it
external.
enters in, the external iliac vein. Okay? Now, back to here. Here's the, again, the external iliac veins. They're right here, again, there should be
An internal.
there should be the internal iliac veins, but I don't see them here, but they should be where the internal iliac arteries are, here and here. So they're probably behind here, but they are there. So the external and the internal together will form the
Common iliac.
common iliacs. And the two common iliacs form the
Inferior super.
inferior vena cava. And the inferior vena cava is accepting these veins,
The renal.
renals, and then this purple one. Remember that purple
That's the
one?
portal, right?
That's all. That's basically collecting all. So it's a combination of the superior mesenteric vein, the inferior mesenteric vein, the splenic vein, the left gastric vein, all of that together, which is bringing all these nutrients from the digestive tract now up, portal, transporting it into the liver. Once it's metabolized, processed, packaged, whatever, modified, it will then go into the blood through these veins right here, hepatic veins in the back, which enter into the inferior vena cava. And then the inferior vena cava comes up and enters into the right atrium. Okay? The only other veins that I didn't mention are the ones here. What color? What color are the pulmonary veins?
Red.
Red. Good. Okay?
Dr. Myers, on
Yeah.
top you said is in the internal or external, right?
External's on the outside,
Yep.
the smaller one. Internal's on the inside, the big
Okay.
one. Okay?
What about the superior sagittal sinus?
That's not on here. I mean,
Oh,
I'd have,
oh,
yeah, I'd have
oh,
to,
okay.
I'd have to have a laminate for that one.
Oh, okay.
But that's in your lab book,
Yeah.
okay? So maybe during class I'll show you that.